Alright, Matt, I'm just going to cleanse your face with a Clarisonic brush like the first time. You'll feel a little bit of vibration on the face. You ready?
Mm-hmm.
Now, after your second treatment as opposed to your first, how did you do? Were you red? Were you inflamed? Or
Actually,
were you less irritated?
Yes, definitely less irritated.
Good. Okay.
What we're doing is we're going to start with the right cheek.
Mm-hmm.
As I said before, so I'm glad that you're noticing improvement. You're noticing, clarify for me what you're noticing improvement with.
Soft, like how soft it is, like a lot of the inflammation is gone.
Perfect.
And a lot of the smaller acne, like the little one,
Mm-hmm.
like not so much the huge pimples, or I don't know what you call them, are going away, but the little ones are definitely going away. Like,
Beautiful.
yeah.
So third treatment in, we talk about all of this being an activity with the pore. Whether it's just very superficial, and that's a blackhead, whether it's a little deeper with a closed top, and that's your pustule, or if much deeper down in the pore, you've got more inflammation, and that's not many, but those are some of the red bumps that I will treat 2 times. The second time has a greater heat delivery, and that usually what helps, but that's usually what sometimes hurts a little bit. The other aspect is, I'll probably change and do the second one with the yellow tip. One part of your acne is probably 2 stages. And I think that's the frustration part of it. Some of it is active acne, but then you have the remnants of your old acne. Remnants of your old acne will be redness. And so people will just say, oh, I have so much scarring. But to me, we kind of break it down into, is there a texture change? Is there scar tissue? Or is there just, the fancy term is post-inflammatory, so after all that redness, if there's a change in color. And Isolaz, if you use a little bit of a different handpiece, the yellow handpiece, you can also lighten some of the inflammation that's going on. And so I can't rebuild the collagen, that would be a completely different laser, but you can nicely soften the redness, and that's another goal of ours. We're going to spray the nose, and I'm going to use the larger tip for the nose area. Great. Not anymore. The reason why is there's such a concentration of oil glands.
Yeah.
And oil glands are what produce the sebum, which is initially what clogs the pores. So that's why noses have a lot more gunk, but sebum. But also oil glands are a lot more affected by hormones, and that's kind of sometimes what kicks the whole process off. What we're going to do is there's the product that we used in the past. One side has benzoyl peroxide, the other side has a salicylic, low, 2%, and so we're just going to swab this area. So salicylic acid's over the counter. It's in a lot of products as far as cleansers. It's in some acne kits, cleansers, toners, and lotions. But it's called a keratolytic. When we talk about acne treatments, we're dividing up the acne. We're dividing it up into inflammation, That's what a lot of the oral antibiotics do. They try to decrease inflammation. Some of the topical antibiotics try to decrease inflammation. But if somebody's acne is very much a clogged pore, then you're dealing with a keratolytic, something that lyses or lytics keratin. And keratin is dead skin cells. So you get sebum, you get dead skin cells. Salicylic is the best, well-tolerated, over-the-counter keratolytic. And then when you go a higher strength, that's what all the retinoids are. Retinoids are exfoliants and keratolytics. So the Differin that you're using at home is another form of a keratolytic to help exfoliate. Because if we did all this and then all of a sudden we didn't exfoliate the skin cells anymore, then they would just fill right back up the pores. Alright, I'm going to come through this area. You tolerated the treatment I just did perfectly, so I'm going to repeat it, pushing in the salicylic acid. What we're going to do is I'm going to have you look towards me. We're going to gently spray the left cheek and then I'll do the chin. Have other people noticed that your skin looks different?
Yes.
Alright, we're going to spray down the forehead. Ready, Matt? What have they noticed that they've made comments on that?
Just that it looks like it's clearing up.
Okay.
And again, that it doesn't look as red and inflamed.
Has anything helped as much as Isolaz in the past?
The Become skincare that I was talking to you about.
Absolutely.
Actually, it wasn't like most skincare treatments that it dries out your face.
Absolutely.
And then just gets back to worse. It did clear up, but I didn't keep on it as much as I should have. But it would bring me to a point where it was tolerable, and then kind of just stay there. And if I probably would have kept doing it, it would have gotten better.
The last one we're going to do is perfusion. Perfusion is where we take salicylic acid. So it's the same thing that we talked about previously, over the counter, and then sometimes 20% if we're doing prescription strength chemical peels. And essentially, like the word sounds, we're perfusing it or pushing it into the skin.
Okay, Matt, we're going to put the salicylic acid perfusion treatment on you. So this is going to help clean out some of that oil from deep down in the pore. And we'll kind of perfuse it into your skin. It's a leave-on treatment.
We can do this. There's a whole bunch of other ingredients. Sometimes there's an anti-aging aspect to perfusion that you don't have to worry about, so that's good. You're just going to feel a vacuum sensor.
It's cool.
What does it feel like?
It feels like it's a much lighter suction, and it's almost relaxing.
Good. Therapeutic, we'll say. Look towards your right shoulder. Awesome. So having this aftermath after everything you've been through that you'll leave on and will just dry is great. Great.
Hey guys, it's Matt. This is getting back to you now after my third treatment. Just going to talk to you guys today about what it's doing to me personally and answer some questions that I've seen from some comments. First of all, what it's done for me personally, I would definitely say it's made me more self-confident. Now talking to people, I'm not as nervous. To answer some questions, the place is in Sarasota, Florida, and it is called DOCS. I don't really know the acronym for it, but the nurses in the building are really nice. They remember me every time I go in there. They ask me how I'm doing. They want to know what's going on. Are the treatments alright? The nurse that treats me every week is awesome. She takes care of me. She tries to do any manual extractions. They always worry about keeping me comfortable, which is awesome. The doctor, she is very careful with the Isolaz. Make sure, like I said, always comfortable. So I'm thankful for that. Also, there's a question about the nose piece. If you guys look in the past videos, they do a nose piece, and what it is it's a little smaller piece that connects to the Isolaz, and it just sucks on my nose and then flashes a little light on my nose. But it is a smaller piece to get on the sides of my nose and on the bridge of my nose. If you guys do want to check the website out, it is called skinidocs.com. And I'm with Dr. Anderson. There's 2 doctors on the website that you guys can check out. Feel free to check anything else out. They are awesome if you guys are anywhere around the area. I did get some questions about pricing. I'm not exactly sure the prices just because I am a winner of the Isolaz treatment, so luckily I don't have to pay for it. But if you guys will hold tight, I'll get back to you guys next week on some prices and just tell you, explaining what the prices of what it would cost if I was doing this out of pocket. So if you guys will keep watching, post some questions. Again, we'll get back to you those before and after pictures. I just got in contact with the nurse. She is going to email me those pictures, so I'll get them up probably by next video. So keep watching and post some more comments. Thanks.